I'd like to talk about that most men suffer from to varying degrees after their late 40s is BPH, benign prostatic hyperplasia, i.e. an enlarged prostate as we get older. This comes about when the prostate gland starts to enlarge and starts to squeeze the bladder and starts to restrict the urethra. Thus you get the urge to pee more regularly, especially at night, and also the flow of urine can be restricted or reduced. Most of us men will know when we start to experience these symptoms. We find ourselves needing to pee more regularly during the day and possibly having to wake up at night to pee. This may be caused by a number of reasons. Firstly, as men age, they put on more body fat, especially around the stomach, and this may convert some of the male hormone testosterone to the female hormone estrogen. We may find we get a little bit more fat around the chest. Also, the male hormone testosterone, some of it may be converted to dihydrotestosterone, commonly referred to as DHT. It is linked to male pattern baldness, and also what some people don't know, also hair loss in women, as women can also produce DHT. Women produce a smaller amount of the male hormone testosterone, which may also then convert to DHT, giving them some degree of hair loss. Also, something that is really talked about is insulin resistance, where the body through diet, what we eat or drink, is elevating our blood sugar, which produces too much insulin, too much of an insulin response in our body. This will make the prostate gland larger, as insulin is a growth factor, and that is why some bodybuilders inject themselves with insulin to grow bigger. Common drugs like tamsulosin are prescribed by your doctor, but they all carry potential side effects, especially to a man's sexual functions. There are certain herbs and supplements that have proved helpful in trying to reduce the size of the prostate. Things such as saw palmetto, stinging nettle, lycopene, and zinc. However, there is a protocol that I guarantee you've never heard about, as it is a protocol that I developed for myself, and if you adopt the same protocol, you will not have to use any supplements or any drugs to keep your prostate healthy. I've tested it on myself and others for about 10 years, and it gives by far the greatest success.